some of the things maybe we can't provide, but we can help you get access to. All right. So, Lori, go ahead. Do you want to introduce yourself?
Hello, everyone. My name's Lori Daly. I have been here at Frederick a little over 6 years. I have been in Magnolia and memory care for the first almost 6 years, and then took over Jamie's role in May. While Jamie was a full-time nurse here, I am 20 hours per week. And I've been a nurse for 20 years. I spent the first 14 years of my career, 14 to 15 in skilled nursing, acute rehab, wound care, and stroke rehab. And then I made the move to personal care and memory care back in, well 6 years ago. What was that? 2019 here at Frederick, and I love it here.
Part of what Lori does for us with the Wellness Suite is that she completes assessments. She can work with some minor treatments that we might have available, and she can also coordinate with other medical professionals. So if you have like a cardiologist or a nephrologist or a neurologist and you need some help speaking with them, understanding what the orders are from the doctors, what the doctors are meaning to say, Lori can help you out with that. As the social worker here, I will also complete assessment and service planning, but my assessment and service planning is a little bit different than a clinical one. My assessment is going to be somebody coming to me saying, hey, I need this. I need help with coordinating, I don't know, let's think of something. I need help with coordinating some in-home care. I need help with hiring somebody to come into my home. I need help with some financial assistance. I need help getting things organized. I need help writing out my living will or writing out my will. I can't do all of those things, but I can coordinate those services for you. So we'll sit down together. We'll talk about what your needs are. We will go ahead then and create a plan together of how we're going to meet your need. I can never guarantee that I am going to work a miracle. I'm a social worker, not a miracle worker. Some of you have heard me say that. But what I can guarantee is that I will give you 100% of my effort into helping you achieve the goals that you have, whatever those goals are. Another piece that I do is I help coordinate with resources. So, Tammy, I need to get my will together. Well, I can't do that. I'm not a lawyer, but I do have a couple lawyers in my pocket that I've worked with over the years that I've vetted out and feel like they're pretty decent people and will help you out with the things that you need to get taken care of. I might need help with calling an auction house. I might need help with coordinating a new physician. I've never done that before. Lori could also help with that too, but that's something that I can help with as well if I'm more available than she is. Oh, crud. Oh, man, I'm messing this all up, guys. I don't know what to do. Ooh, I think I have to go back here. So the other piece of things is mental health. I can help out, get you coordinated with a mental health practitioner if you're not comfortable with that, or if it's just a 1 or 2 time thing that you're feeling really stressed out about something. I can come and sit with you and we can work that through. I'm also working on coordinating group services. I have heard along the grapevine that people might be interested in a grief support group, so I am working towards getting something like that put together. If there's other if there's other support services in the community that you guys are interested in, we can certainly talk about that and what we can do. We can also talk about having some other conversations and meetings about like different things that the Wellness Suite can provide. So I know one meeting that we had, we were talking about advanced directives and conversations regarding that. That is something that we can do a presentation on and help you guys work through. And then both of us will help monitor your health. Lori will help monitor your health care and follow up with you. And I will help monitor how things are going and if your services have been provided, and if not, I'll get on the phone and try to make sure that PT's coming out to your house, the visiting nurses are coming out to your house, things along those lines. I have to figure out what I did on this computer. I'm sorry, I'm really early. Oh.
And to touch on just what she was saying about having a presentation on advanced directives, we'd also like to start some wellness presentations. You know, maybe we're going to have a presentation on how can we prevent strokes, how can we prevent, or how can we encourage cardiovascular health and things like that. We'd like to start having some programs like that here, and that's something Tammy and I are going to work with together also. I'm sorry. Having presentations on things like stroke prevention or how we can benefit from cardiovascular health. We'd like to start having some wellness, what would you call it? Not a seminar. Not a seminar. A seminar or a presentation. And that is something that Tammy and I are going to start working together on also.
So also in going through that as part of our goals in the wellness program, we want to also provide you consistency with the services that we are providing, transparency in any billing that you might receive from our services, help you, the goal of the Wellness Suite is to help you remain at your highest level of independence. That's the goal of everywhere that you live in Frederick. If you live in personal care, that's their goal. If you live in Cedarwood, that's their goal. Our goal is always to help everybody who lives with us to maintain their highest level of independence. So how can we help you guys in where you live maintain that? And then we also, like we were talking about, coordinating additional services or help you with a transition to a different service line that we provide. If you're feeling like, ooh, I might need a little extra help, I'm not sure if it's ready for me to go to personal care or if I should bring someone in, we can help work you through that. All right. Lori's going to talk about the nursing time and a la carte services that we provide and a little bit about the billing.
Okay. So we do offer a free yearly physical assessment for anybody that would like one. I can come in, I can assess you head to toe. I can look around in your apartment and say, I really think you should have the shower handle, or I really think you should remove these throw rugs and things like that. There are some things that are not included in the Wellness Suite services for independent because you are independent, and one of those is wound care. And when I say wound care, I don't just mean a Band-Aid and a tab. There's no charge, you know, triple antibiotic ointment, there's no charge for that. But extensive wound care where you require multiple layers of dressing or medicated wound care items such as MediHoney or Silvadene. Things like that are charged. So it's done on a wound care package basis. The more complex the wound, the more it costs for that to be done. So I'm just...
What's a good example of like a simple wound versus...
So a simple wound would be, we're cleansing your wound, we're putting on Zeroform to promote healing, followed by a dressing. A Zeroform is sort of another petroleum dressing that goes under a regular dressing. That would be a simple wound. A complex wound would be a wet to dry wound. We're soaking a dressing in a solution, and then we're putting it on your wound, and we're waiting for it to dry, and we're taking it off, and we're slowly debriding it. So that would cost a little bit more money. Another thing that wouldn't be covered is medication administration, because you are independent. Any sort of like PO or like by mouth or IV medication administration or injections, there would be a charge for that also, or anything that we are applying to you. So recently we have had a lot of people be put on compression stockings. If we are having to apply something like that, there is going to be a charge for that. Most of the other services, you know, emergencies and things like that, anything that you should need, blood pressure check, you want to come down and get your vitals taken, you're not feeling well and you need some Zofran, and, you know, can you help assist me in getting this from my doctor, getting it from the pharmacy, those kinds of things are just included. That's really it for the wounds, right? Okay. And then if your wound is extremely complex and it is something that needs to be taken care of every day, because I am only here Monday, Wednesday, and Friday, I would consult with our wound care services. I would get you that referral, and I would make the referral to them. Usually insurance comes into play and pays for things at that point. Your mic closer. Can you hear me? I'm sorry. I'm so sorry. I hate being in front of people. So what I was saying was, if your wound is complex and it is something that needs to be changed every day, I would assist you in getting an order for wound care from your doctor and making the referral to our wound care consult services. And then usually, the first thing they do is run your insurance, so there's no surprises, and then insurance will usually step in and pay for it.
We also want to let you know that there's no fees for things like if you have an emergency and we have to come over and assess you and see if you need hospital, have us call emergency services for you. There's no charge also for us to follow up with you after you have come back to your accommodation from a rehab, from a hospital stay, from an emergency visit. We want to make sure that you guys are doing well, that you're doing well in your own environment, and that you have the services that will help you stay that way. So that is all included in it. Okay, do you want to talk about the case management subscription?
So if you are living in your home and feel that you are not able to manage your own care, it doesn't necessarily mean that, right away you're thinking, do I have to move to PC or Magnolia? We do have something called a case management subscription, which is where you pay a monthly fee and then I can manage those things for you. I can manage your medications with your provider. We could monitor blood pressures for parameters on your blood pressure medications. A big one would be diabetic management and chronic wound care. So those are some things that if you are frequently needing me, rather than being charged on an individual basis, it might better benefit you to just subscribe to the monthly payment and have that access to me.
Yes.
I have a question, and maybe you answered it, and
Should I? Am I being followed the camera?
I'm sorry. Last year, my husband and I were both hospitalized at the same time and came home the same day, which I might add, and our pipes were frozen that day too, but that was taken care of by the people here. But nobody ever contacted us after we came home. That was in January of this year, I guess. Yeah. And I wondered a couple weeks later, now they did set up services for us from the hospital to have the PT come from outpatient, and then we got PT here and that type of thing. But I was never contacted by anyone else. I mean, we kind of managed that ourselves. And so are you to report, how do you even know when we're in the hospital? I mean.
That's a great question.
Yeah.
Sometimes we just hear it through the rumor mill. Some people do give us a call and say, hey, we were in the hospital, or I was in the hospital, and this is what's going on with me. Sometimes we will have maintenance who might come and answer a pendant if somebody fell. They'll let us know. So there are ways for us to find out, but if you don't want to rely on those word of mouth ways, give us a call and let us know.
Yeah.
Because we will follow up with you and we'll make sure that your services are coming in on time or that you don't need something extra.
Yeah. Please call us, because I can't speak to anything that happened before, I started this position in May, but I am when someone returns from the hospital, I'm there. I'm calling to go over. I'm looking for anybody recently, but I don't see anyone. I am going out the next available day that I am here to see anybody that's out to the hospital. So please call and let us know.
If Lori is not here that day, I have also been known to swing by, not a nurse, another famous saying of mine, but I will just talk to you, see how you're doing, make sure that you are comfortable, and then Lori will come and do her assessment the next time that she's in.
Sorry, I was just here to listen, actually. But I did want to add one quick thing. We did not have Tammy's physician prior to June of this year. We did, as Lori had mentioned, have a wellness nurse at 20 hours a week. That was Jamie's schedule. The other 20 was dedicated to skilled nursing. So in recognition of things such as you just mentioned there, that you were in the hospital, you and Skip were in the hospital, without any sort of coordination or connection, having a position such as Tammy's and a person such as Tammy in place, that can help beef up the services that we provide to residents, particularly residents in independent living, to coordinate those services. So that was part of our thinking in enhancing the services that we provide. So really, I'm just listening. Sorry, I couldn't help myself.
Thank you for your input, though. So that was another big reason why we wanted to have this. Some of you guys have met me throughout the different talks that we've had. I've been to the coffee and conversation. I've been through other talks to introduce myself because I am new. And Lori is new to this position as well. So we wanted to kind of go through, like I had mentioned in the beginning, just some of the things that might look a little different in the Wellness Suite. Kind of compact what we do and streamline it.
If you use the physician here as your primary physician, does that make any difference in the services you get here?
Well, it does make it a lot easier for me to do things for you. Yes, I guess it would make a little bit of a difference because Mary's here or Dr. Samuels are here when I'm here. So it's just that easy for me to turn around and say, no, so-and-so needs X, Y, Z.
The service provision isn't different, it's how quickly the service gets accomplished. Lori will always try to, and I have as well, work with doctors' offices outside of our community to help get you what you need. I've called doctors' offices and said, hey, can we get a PT script? Or, you know, if there's a medical issue and you need a new medication or a refill on something, Lori has called and been able to take the order. We don't have, right, it's faster with
The
our
faster
doctors
response time.
because of the relationship that we have with the doctors that come here. If we're calling a community doctor, how do they really know besides me saying, hi, I'm a social worker, or Lori saying, hi, I'm a nurse, right? It might take them a little bit of time to get back to us. But with our doctors here, we can just right away get what you need. So that's the biggest difference. Will we do the service? Absolutely. It just might take a little longer. Any other questions? Yes.
Just a comment, Larry had a fall, I think it was the beginning of July, and they did check on us. Tammy came to our house. Actually, I think it was 4th of July, because I said, you're coming on a holiday? And,
I didn't have time off yet.
so yes, they did follow up on Larry's fall, so, and Lori was able to help us too, so.
How do you transition from an off-campus PCP to the doctor here?
So if you wanted to do that, we would take your profile sheet or your admission information and your insurance information, and we would give it to the suburban geriatric social worker, Kelly, and she would run everything, and then she would actually request the documents from the other doctor, right? She requests your files from the other doctor, and then she would let us know when you can be seen.
What are the hours for the doctor here? And if he's not here and you need some care right away, what happens then?
So our nurse practitioner is here Monday and Wednesday from around 8 to 3, but she also does see PC, Cedarwood, and memory care. You can make appointments with her those 2 days, and then Dr. Samuels is here every Friday from about the same time. Should you need emergency care in between them, like an example, like if you were sick, So we usually would try to put you on for the next available day to be seen. If it was something very urgent, people still have to go to urgent care, unfortunately. Or if it was really bad, the ER. But we usually do try to get you in the next available day to be seen. They're hesitant to call in prescriptions and things like that without seeing someone, depending on what it is and if it's a chronic issue.
Any other questions?
I recently transferred my medical care to Frederick here from my previous provider, but I've never been informed what the address is of my provider here. Is it Frederick, or does my doctor here have a separate office address that we should use and a telephone number? Because those are questions that we're always asked when we go to a specialist.
It is separate. It's Suburban Geriatrics, and I have their number memorized. But if you want to stop by the Wellness Suite afterwards, I can give you their address. But it's a separate address. It's a separate address. It is their own office, Suburban Geriatrics, and a separate phone number. When you're listing them as your PCP at a specialist, you want to use their address and phone number. And I can get that for you. I can give that to you.
How do I get that?
Well, come to see us after this in the Wellness Suite, and we'll give you the information,
Thank you.
okay? And if anybody wants to do that, that has Suburban Geriatrics, we're happy to give you their information.
Thank you. I have a question about charges for bandaging. I've had scalp cancer, melanoma, twice now. It's likely to come back. It requires bandaging for 4 or 5 weeks, daily bandage, and I can't see what I'm doing. If I come in, is it going to be a charge each time?
So, Mr. Edsel, I feel like you would probably benefit from just doing the monthly subscription at that point, because there would be a charge for the bandage, and instead of charging for each one, it would probably be less if you just subscribe to the case management.
Thank you.
And again, if it's a daily change, we can also help assist you into getting visiting nurses for the days that Lori isn't here.
Right, because I am only here 3 days a week. So that's another thing to just keep in mind.
And when you
Anybody
sign
else?
up for the, whatever you call that, the subscription kind of thing, do you do it for a year? Do you do it for a period when you need it, or do it forever?
That's a monthly subscription.
So you can stop it at any time.
Yes, it's just monthly.
Is there any thought to the future of whether you will have a full-time nurse here every day? I think we should be entitled to that.
I think that is something that we haven't really talked about at this point, but as the needs arise, is definitely a good conversation that we could have. I'm going to come behind you. It'll be a little clearer. Here you go.
Are any of the medical charges paid by our medical insurance?
No, unfortunately, the medical charge for the nurse would not be. I'm free, but I'm not a nurse. But no, the things that Lori does would not be covered by your insurance, which is why we do try to make that at a lower cost. But again, if you need like skilled wound care or, you know, a visiting nurse every single day, that is something that would be covered by your insurance, and we can coordinate that for you.
Yes, sometimes if you have a wound that is bad enough and your doctor will write the script for home care, that would be covered by your insurance, and we can coordinate that for you. We can set it up for you. We just need the order and the script from your doctor, and then it would be covered.
Going once?
No? Is that it?
Well, we want to thank you guys for
Yeah,
coming
thank
today.
you.
We do have one public service
We
announcement.
do.
If you have signed up for our September vaccine clinic, no matter which shot or both that you have signed up for, and you have not signed your consent form, could you please make your way over to the Wellness Suite after this? The reason why is that we do need your consent form signed. We have to send those in at least 3 days prior. If you don't have the form signed and sent in, there won't be a vaccine for you and we'll have to change your appointment to a different date. So Cindy is well aware that anybody who hasn't had their consent signed is going to come down to see her, so she's ready for you all.
And if anybody has any questions, I'll hang around for a little bit that you don't want to say out loud and want to talk to me about 101. I'll hang out for a little bit too.
Oh, you have questions, and you want this?
Do you young ladies make arrangements to meet with an otologist, a hearing doctor?
We have an audiologist that comes in here.
Okay, and how do I coordinate meeting with this individual?
You can just stop by the Wellness Suite and see Cindy, or you can call us if you don't want to do that.
So
Either
just
way.
visit the health suite.
Yep.
Thank you. And thank you, young ladies, for this program.
Thank you for making time for us.
Well, if that, oh, a couple more, all right. We're sparking all the ideas today.
What kind of doctors come here?
So we have primary care doctors and nurse practitioners. We have an audiologist. We have can you hear me? I'm sorry. We have an audiologist. We have a hearing aid specialist. We have 2 different podiatrists, dermatology. We have dental. I believe that's it. And an eye doctor.
Can you put some of this on paper? Because I'm not going to remember it after I walk out the door.
Sure. Yeah, no problem. Anybody else?
I have the same question this young lady had. Where do we find and print this information?
What I think we can do is put it on paper and send it out to everybody.
Yeah, we'll just do
That's
a
agreeable.
mailing, that way everybody has it.
When you say you're going to put it on paper and send it out to everyone, are you young ladies saying you're going to put it in mailboxes?
Yeah, yeah. We will make up a written document of the bullet points of this, as well as what providers come to the Wellness Suite, and then we'll send that through the mail.
Just like we did the flu vaccine flyer.
Thank you.
All right. Anybody else? One final question? All right. Well, thank you guys so much for your time and coming to learn a little bit about what
Thank
our
you.
community-based Wellness Suite services are. Thank you.